Hello, I'm Dr. Martin Bastuba. I'm a urologist with specialized training in male fertility and in sterilization procedures. As we say, we giveth and we also taketh away, depending on what the need is for a specific patient. I was originally born in Detroit, Michigan, did some of my training there, then went down to Atlanta, where I was at Emory University and did 6 years of general urology training, but that wasn't enough. I then went to Boston University and did another year of fellowship training, specializing more in male fertility and male sexual dysfunction. I've now been in San Diego for over 20 years and have had the wonderful experience of thousands and thousands of patients over those 20-year period. I've done well over 3,000 vasectomy reversals. I've done well over 5,000 no-scalpel vasectomies. And so I have a lot of experience, and I also have a lot of passion. I love doing this stuff, and I want to bring that experience and passion to you to try to improve your life in ways that you want. A vasectomy is a procedure that for many men is a little uneasy for them to contemplate. For many men, it's the first procedure that they'll have had in their lives, and so there's a little bit of uneasiness. One of my goals is to try to give you truth rather than fiction, and hopefully help you to feel more settled with this as being a reasonable choice should you decide to go forward with a vasectomy procedure. As part of the procedure, you need to fill out the medical history and personal history forms. Please try to do this ahead of time in a thoughtful way so that once you're in the office, we're able to move through things in an efficient manner. Sometimes it's difficult to remember things that may have happened a number of years ago, so if you're able to do it ahead of time, it's useful. Also, take advantage of the opportunity to download many of our forms from the computer in your home so that you can fill them out ahead of time, even if you haven't received a packet from my office. This is very useful, and so please take advantage of it. We've spent a lot of time and effort to try to make things available to you. Some prior conditions have an impact on the procedure, and so, for instance, if you're on blood thinners, that we need to know about, and we might want you to come off them prior to the procedure. And so again, these medical conditions are important. If you have significant sleep apnea, which is loud snoring and even stopping breathing during sleep, that's something that may affect the way we would do a procedure because of concern about your postoperative care. So again, attention to these things on the history are important. I will go through those things with you in the office. What the rest of this video is focused on is trying to give you a lot of information that I'd like you to know about the procedure. So let's get started. It's important to know that vasectomy is considered a permanent procedure, but it's possible to have your cake and eat it too, in the sense that I am the owner of a sperm bank, and I feel very strongly that it's wise to consider carefully whether you want to freeze sperm prior to your procedure. No one else in the country offers anything near the opportunity that we do in terms of freezing sperm. Let me put it this way. If you were to walk in off the street and want to freeze sperm, it's about $1,500 to $1,800 to do so. For my vasectomy patients, we offer sperm freezing for $500. This includes 3 specimens, each of which we can typically get multiple vials from, and 3 years of storage. After that, it's a nominal fee of a few $100s a year to upkeep the sperm once we have it. Each of those small vials can be thawed out and used for what guys often refer to as turkey baster technique, also known more scientifically as intrauterine insemination, or IUI, or artificial insemination. Once we have those specimens, it allows you to have your vasectomy procedure with the knowledge that if there ever was a change in heart or a change in your family situation, that you once again would consider having the return of fertility. You could do it in a very cost-effective way, since to do an insemination or turkey baster technique is only about $300 to $500. So it's a very cost-effective way to protect that part of your relationship, that part of your maleness. And for many guys, it's just an extra measure of control of the situation, because no one else can use that specimen without your written approval, even your wife. And so you have control of that specimen in a very cost-effective way. For many guys, it just gives you the feeling of comfort that you're okay with moving forward with the procedure. In guy talk, it's nice to have a loaded gun in the closet, and this allows you to do that. Prior to the procedure, you'll want to shave the appropriate part of your body. Now, it is possible to do the vasectomy through a single opening, but that forces you to be low and near the testicles. I choose to do things as far away from the testicles as possible, thus limiting any kind of a situation of a side effect of buildup of pressure, or as guys might refer to it, blue balls. And so that puts me high in the scrotum on each side, and so I like you to shave this area and down onto the mid portion of the scrotum, and any tufts of hair that might get into the upper part of your scrotum area. You do that ahead of time, shower, and then come in for the procedure, and it will move things along. The shaving of the area down there, or manscaping, is something that's not completely comfortable for many men. And if you're not comfortable with that, you might ask for help from your partner, because oftentimes it is easier for two people or someone who is more comfortable with shaving that area. It's very important to know about the procedure. Realize that vasectomy cannot and will not change sex drive or sexual performance, erections, ejaculation, orgasm, or any of those things. It can't. The reason for that is the only thing that is done during a vasectomy is to block the tube that sperm goes through. And that's the only thing that goes through that tube. Your testosterone and hormones made in the testicles go through the bloodstream. It's a separate system, so it just can't be impacted by this procedure. What we do notice from many couples, and hopefully for you, is that the sex gets better. If you don't have to pull out, don't have to wear condoms, foams, IUDs, or many of the distractions to try to control the fertility aspect, for many couples it leads to a more relaxed situation and hopefully some of the best sex of your lives. Other things that are important to know about the vasectomy procedure is that currently we do it using a no scalpel technique, and even further, a no needle technique. For the procedure, you need to be numbed up, and that is kind of like going to the dentist. The injection itself is a little bit uncomfortable, but following it you feel numbness, but no pain, nothing sharp. For a vasectomy, I've taken it a step further, where you don't even need a needle injection. The Matajet device is a device that is simply placed on the skin. Here is skin, here is the device. Put it on the skin, release, and it puts the medication into the skin, through the skin, and right into the vas deferens tube without any needle. Guys like it, and I like it because it works, and it makes guys feel more comfortable. The other thing I do is to have the man take a couple of pain pills about an hour before the procedure is planned. That way, you come in feeling no pain. Now, this can only be done when you have a driver, but for the vasectomy procedure, you need someone to bring you to the office and drive you home. So why not take a couple of pain pills ahead of time to try to minimize stress and minimize any discomfort of the procedure itself. My goal is to have this procedure go so smoothly that you want to tell all your friends, please go to the San Diego Vasectomy Center because Dr. Bastuba took care of things well and that there wasn't any problems. And this is a part of that. Another important part of things is to do the procedure at a time when you can take it easy. The day of the procedure and the following day, I want you off your feet. You're in the lazy boy chair, feet elevated, ice pack on in the area, TV clicker in one hand, and just taking it easy. That's very important for things going smoothly. Day of the procedure and the following day. Having done over 5,000 no scalpel vasectomy procedures, I have a pretty good sense of what I'm talking about. And almost to a man, it's that guy who did too much too soon, who's the one that you've heard about that was having discomfort for a significant period of time following the procedure. Don't be that guy. What I like, in general, and especially for surgery, is boring success, routine victory. Be a little bored following the procedure, but be successful in the sense that it went without any incident, that things moved along very easily for you. That's what we like to see, and that leads to good results. So plan on doing the procedure at a time when you can take it easy, especially for those first few days. I will give you special instructions in terms of your work situation once I know precisely what it is. Certainly it's different for a man who sits at a desk than one who's swinging a sledgehammer in a very physical way. And we'll discuss those things. I make a strong effort to try to be realistic with you in terms of how things might affect your personal and work schedules. To this point, after 5,000 vasectomy procedures, I've not had a patient with a significant pain syndrome. I've seen some other people's problems, though, and I have a deep, deep respect for it. The no scalpel procedure, I think, is very important in terms of limiting any possibility of postoperative discomfort syndromes. The reason for that is, with the no scalpel technique, I bring the vas deferens right up in front of my very eyes where I can see exactly what's going on. Another thing that is done is to work high in the scrotum, as far away as possible from the testicles. This also limits any possibility of some pressure buildup or what guys might refer to as blue balls. And that's why I have you shave high in the scrotum and do things that way. The third thing that I ask you to do is to try to just go slow following the procedure. I like a man to wait 10 to maybe 14 days to start ejaculating following the vasectomy procedure, and even after that, just go slow with getting back into the swing of things. My goal is for you to have years and years of entertainment from this procedure and hopefully lead you to a new level of intimacy in your personal relationship. And so doing things slowly and allowing the body to heal is also very important in having a good outcome. There is a product known as Exparel. This product will have the area numbed for up to 72 hours following the procedure. As I say, I've done thousands of these procedures without use of a product like this, but for some guys it's very effective. In particular, if there is a history of sleep apnea, a product like this pretty much reduces the chance of any need for any narcotic agents, which can prove to be difficult in patients with sleep apnea, which is abnormal breathing when you're trying to sleep. And so it gives us just another option. Some men, they just don't want to feel anything in that area. And so the Exparel allows a man to have the procedure virtually pain-free. Obviously everything, some people do better with things than others, but in my experience, when we use this type of a product, you're just not going to feel anything down there. And so for some men, it's quite useful. It is important to know that immediately following the vasectomy procedure, nothing has changed. How can this be, you say, Doc? I thought you blocked me off. Well, yes, you are blocked off with the vasectomy procedure here in the scrotum. So the testicle is not putting any new product into the system. But downstream, back behind the prostate gland, there is a structure known as the seminal vesicle, actually one on each side. And there may be 1 billion sperm stored in the seminal vesicles between the two sides. And those swimmers will still be coming out following the procedure for months. How can that be, you ask? Well, studies have shown that sperm can stay alive inside a man after they're mature, but before they're ejaculated, 4 months. And so, with such a high number of sperm in the seminal vesicle, they'll still be coming out. So it's very important that you continue to use whatever method or methods of contraception that you currently employ following the vasectomy procedure until you get the green light that it's okay to discontinue them. This leads to the next question. Okay, Doc, when do I get the green light and how do I get it? The American Urological Association studied thousands of patients and came to the final conclusion that 3 months is the optimum time following a procedure to do a semen analysis. Yes, a semen analysis is the only way we can give you the green light. We need to scientifically prove that you meet criteria that were developed by the American Urological Association before we can give you the green light that it's okay to discontinue other methods of contraception. And so to recap, we do a semen analysis at 3 months following the procedure. Almost always, it's one and done. We do the semen analysis. You meet the criteria as stipulated by the American Urological Association, and you're given the green light to discontinue other methods of contraception. There are many things on the web that are misleading and I believe were put there by people trying to hurt other people, such as if you ejaculate 15 times in 3 days, you're good, you don't need testing. This is a fallacy, this is wrong. You need to do a semen analysis, and that is the only way to be confident that we are good following the vasectomy procedure. Anything other than that is taking chances in an area that you don't want to take chances in, or you wouldn't have come for the vasectomy in the first place. So please, follow what we ask you to do to the letter, and you will do fine with your procedure. And again, our goal is to have you have years and years of entertainment from the procedure, and that it will change your life in a positive and meaningful way. It is very important to use an athletic supporter following the procedure. Not one with a hard cup, but one that has the soft supporter. You can get one at almost any athletic store, and try to get one that is comfortable for your waist. They tend to run about a size smaller than indicated on the package. And by that I mean if you typically wear a medium, get a size large and it's probably going to fit your waist more comfortably. Most men choose to wear the jockstrap or athletic supporter for a week or two following the procedure. Longer if you have a very physical job or if you are very physical in your life. And so that's an important part of things. An athletic supporter really works better than even the Under Armour type of combat underwear. Those type of things are okay. They're certainly better than boxer type shorts, but an athletic supporter is still the best thing. And get one that's comfortable for you. Figure that out ahead of time and bring it with you for the procedure. Again, our goal is to have this go very smoothly for you. Risks of the procedure are identified in the handout trifold that you will get when you're at the office. Any procedure has the general risks of infection, bleeding, and anesthesia. These are small risks because of the small superficial nature of the procedure. For instance, if you have bleeding, well, direct pressure, like you would do for a nosebleed, is typically all that is needed. This is not a procedure that's done deep in the body, and it's a very visible area. So be aware of those risks, even though they are small. And then there are the more specific risks. They are indicated here, for the most part, to include sperm granuloma, sperm buildup, epididymitis, sperm antibodies, long-term testicular discomfort, and what is known as the return of sperm to the ejaculate. Let's just go through two of them. The potential side effect that men worry about the most is postoperative discomfort, congestion, blue balls, if you will. This is an unusual complication, and I've never had a patient have a significant pain syndrome after 5,000 of these procedures. So the incidence for me is way under 1%, but it's still there, and I like men to be aware of that as a possibility, though a rare one. We limit that as a possibility by the way we do the procedure and by limiting your activity for a while following the procedure. The other potential side effect that men wonder about is it possible for things to reconnect and I have sperm come back in my ejaculate even though it went away early on? The incidence of that has been reported to widely vary from 1 in 2,000 up to maybe 1 in 100,000. The American Urological Association chose to take the lowest figure that has been reported in studies. And so I list the possibility of that as 1 in 2,000, even though I've done thousands of these procedures and I've never seen it in any of my patients. It is still a possibility. And one reason for that is that sperm cells, I believe, are the most unique cell in the human body in the sense that they have the ability to move, and it's directional mobility or motility as we refer to it. They're trying to beat a new path, find a way to get somewhere. And so that's why we need to be respectful of them. This is another potential side effect to know about, though it is a rare one. And again, after thousands of procedures, I have not experienced it in any of my patients.